to see the change and the transformation in my colleagues from the preparation meeting, where we talk about the elements of their story they want to present when they're on the panel, seeing how they've worked on that and what they bring to their panel preparation, and then having given their story, I've noticed how people walk more confidently in their competence.
We had one celebrated round with a consultant, a very senior nurse and a porter. And in fact it was the porter on that round that absolutely stole the show. And I think what it did for me and for every single person in that room, it changed the way we felt about certain members of staff. We all have preconceived ideas about what people do. And this porter really highlighted the fact that they also witnessed some really traumatic and disturbing things as well. And I can honestly say there wasn't a dry eye in the house. It was the most incredible round.
I think it is difficult, obviously, to measure it. We do get feedback, of course, at the end of every round, and I have to say the feedback has been uniformly positive in the sense of people in the audience appreciating the way the round has gone and that sharing of emotion.
Because Schwartz Rounds are evidence-based, so we knew that if you began to look after staff in that way, if you began to explore the emotional burden of working with patients, the after effect was that patients felt better cared for.
I think there's something about the rounds that value people's strengths, and I think that has shifted and is shifting the culture in our hospice.
So it has a real knock-on effect with patients, so it's a kind of a win-win situation.